Welcome to the Nursing Now podcast. I'm your host, Janelle McSwiggin, and I'm really excited to have on Jen Ohlinger. So she has a really exciting business. It's the Moonflower Coaching Collective, which I absolutely love, not only her name, but also her website. It is just such a beautiful website put together. So I'm really excited to talk about the premise, her whole idea. So Jen, can you introduce yourself, what you do? I'm so excited to have you on.
Thank you. My name's Jen Ohlinger. I'm a holistic nurse coach. I specialize in coaching women through burnout. A lot of my clients are nurses. And I'm also a critical care nurse by day and owner of the Moonflower Collective, like you said.
Wow. So you have a lot going on
So.
right there. And you're still at the bedside, yeah?
Yes. Yeah, for now. I'm transitioning out. It's hard to let go of. I have it's a process to be able to put that down. I'm working on it.
I support you wherever you are. I still have my foot in both realms and I hopscotch back and forth all the time. So someone will ask me if I'm still at the bedside and I'll say no. And then 6 months, I'll be back. I'm definitely still a healer by the whole touch realm. So wherever you are, there's no need to explain. That's awesome. So yeah, tell me about the Moonflower Coaching Collective. So you're a burnout and stress relief coach, right?
Yep.
So you offer a 7-step program for stress release for relief, and nurses are one of your main clients, yeah?
Yeah. Actually, the majority of my clients work in healthcare, and the majority of those are nurses.
I
A
mean,
lot of
there's
critical care.
yeah, there's no surprise there.
Oh, nope, not at all. It's the number one industry to burn out. So,
Oh my gosh. Yeah, yeah. Those statistics are really heartbreaking to hear.
they
I think I read 62% of nurses will be burnt out at one point in their life. I just did another statistic. I think 32% have anxiety currently, and then 30% are depressed currently. So, I mean, the mental health burden of our industry is just huge. So what you're offering is really well received by our industry for sure.
Yes, yes. And you know what? Part of the statistics, I think I read it, maybe the same study, but it was talking about younger nurses under 25. That percent is even higher. It's 69%. And to me, I was like, oh my, okay, so we're burning out younger. So we just need more support. But
Yeah, and that goes right into how many nurses will leave within their first year, which I
yeah,
forget that statistic, but it's horrific as well. The
yeah,
retention across the board is really bad, but then when you think about the nurses that want to be in the community, they want to support the industry, and then they just get burnt out, scared, and leave. And I forget the number. It's a really high number.
yes,
Um,
yes.
and so we can be doing a lot more for this community in general.
I agree, 100%.
Yeah. So you offer one-to-one coaching sessions along with group sessions too. So that's pretty cool that you offer two different methods for that.
Yeah, I have a program I developed. It's very individualized to each person, but it kind of walks you through the 7 steps. It includes one-on-one coaching and group coaching. It's based off of a proven 7-step program, and then I put my own experiences and education into it. And I've had a lot of positive response, and I'm a real believer in it.
Very cool. Very cool.
Yeah.
And so you have a psych nurse background, is that right?
Yeah, well, so actually, before became a nurse, I worked in the mental health field in a lot of different avenues, mostly with adolescents. But then once I became a nurse, I worked in psych for about a year before I transitioned into critical care. And there I worked with geriatric, ended up being my favorite, but geri psych, but worked all over psych. I've always had a strong interest in mental health, so that's always been something I pursue, even as a hobby. Those are the books I'm always reading.
Yes, no, I totally get that. My hobby is writing, and I totally, yeah, go on deep dives for writing for no reason, just for fun. So
Yeah.
that's cool that your bedside mirrors your hobby, and then you're able to see this issue surrounding you, and then found out where your bedside needs your hobby and how you can support that issue.
Yeah, and my critical care specialty is actually neurocritical care. So I'm really into I follow a lot of neurologists and psychologists and everything to do with the brain to me is so fascinating. So
Oh, that's so cool to hear. I think a lot of nurses get stuck because they have this like deep interest and they don't know where that deep interest goes when they leave the bedside. Like they don't know where to like bridge that path. So they just like stay in one position and they just can't like see a different mode of that.
Oh, I totally agree. And I think the most successful nurses are the ones that find a way to integrate that with their nursing skills. Those are the people that take it really far.
Totally. So tell me a little bit about your journey as a nurse to entrepreneur and what role burnout plays, because this is kind of like near and dear to your heart and also to mine as like an advocate. So I think it's like a really interesting and really important story to tell for other people.
Oh yeah, oh totally. So, similar to your story, it starts with burnout.
Yeah.
After listening to you, I love your advocacy. Before I get started, by the way, like it is so needed right now. So I just thank you for that.
Oh,
But yes,
absolutely.
so like I said, I've been a critical care nurse for a little over a decade, worked in all kinds of ICUs all over the country. And then prior to that, I worked in the mental health field for about 5 years. And so as a result of that, I burned out many, many times. So once you burnout is something that if you don't nip it in the butt and find the core, address what's really going on, you can put a band-aid on it, but it just gets worse. It's very cyclical. And by the end, I was in a habitual burnout cycle that was starting to affect my physical health in many, many ways. And my worst fear was like ending up a patient in one of the ICUs that I'm working in. So I started reaching out to as many providers as I could, and I got a lot of medications prescribed, but not a lot of support. I went to therapy, did the EAP thing, all of that, and I got some helpful tools, but I felt like I was never really addressing the real issue. And personally, I've always been into holistic health. So I saw like a nurse coaching holistic health program. And after like, contemplating NP school and all the things we do, like how do I transition out of bedside? I didn't want to transition further into the healthcare system. So I was like, I'm going to try this holistic route. And through that program, you're coached from the program and then through your peers. I feel like talking to women who understood, who had been where I had been, validating my feelings, I was able to like finally heal, open up, get to the like root of what was going on. And I'm like, there's something to this, because burnout, you just feel so alone. I went to everyone and I had no answers. So I was like, I love mental health. This is something I've just experienced and it's been so powerful for me. So I just started learning everything I could. And it's like, I'm launching, this is what I'm doing. So that's what I did. And I'm like full force going straight ahead.
I absolutely love that. I picked up on a couple of things you said. One, that burnout is like a real physical manifestation. It can like affect your heart. It can affect like your immune system, your stomach. Like I looked
Yeah.
at the effects of burnout just the other day again, and it's like a whole body issue. I think that some people think of it as like a one-dimensional thing. So when they have other symptoms, they don't think of it as related until they like have that aha moment. And you're like, oh, if you can fix this burnout issue, then like I'll stop getting sick as much. Like my cardiac issues may improve. So I love that you said that. And I love that you also said that you sought that you felt more, I guess, holistically cared for through your peers. I think it's so important to seek out connection through others. Like owning your own business sometimes being a burnt out nurse, like those are all like really isolating experiences and they just continue to be more and more isolating until you like make that connection with another person. So
Yeah.
that's really cool too that you felt that and that you were like that was one of those like pick yourself up kind of moments with those around you.
Yes, yes. I mean that's a huge emphasis of my program too. It's like women healing community, and it's really hard to validate yourself. It's like we're the first to push things under the rug for ourselves and minimize, and we do it without even knowing. And sometimes it really takes hearing someone from whatever background they are that has the same experiences for you to allow yourself to feel it and go through it. And that's a big part of burnout, is having the right support.
Yeah, I think it's a women problem and I think it's also like a nursing problem. I think we're
Mm-hmm.
always taught to just
Yes.
keep going. Like so much of it is like patient-centered care that we forget to like really check in with our own body and like make sure that we're doing what we can do to make ourselves like not only survive the shift, but also like be okay for our days off and for our families and for ourselves and for our friends because like our work isn't our entire life. it
Hmm.
like is only one part of that. But if you let your work become your entire life, then it can cause burnout and everything.
Yeah, I feel like the industry and like somewhat our culture kind of tries to push this self-sacrifice as like a noble thing, and it's not. It's damaging. And I wish it would stop.
Yeah, yeah, I go
But
into that a lot. I call it like the nurse martyrdom. I
yeah,
push back on that a lot. I always say
yeah,
like it's not a calling, it's a career. Because the second you
yes.
call it a calling, then it's a martyrdom, and
Hmm.
we don't fight for our rights. Like we can have a deep, deep want to be healers and to help people, but at the same time, it doesn't mean that we get to have our rights stripped away as workers. So I'm trying to like gently push back on nursing
Hmm.
is not a calling, it's a career, and we are not martyrs. We are just workers. Like, leave your stuff at
Yeah.
the shift. So, yeah, it's nice to hear another nurse say that.
Thank you. I also wanted to touch on what you said about like the physical health too, because in my clients specific, like I so many times once we've gotten into the work, it's like, you know what, they finally acknowledge all the physical symptoms they were having. I think they don't realize it until they start to go away or start to find some relief. All of the things that they thought maybe were being caused by other things that really are a result of chronic stress.
Totally. Or they might just not even like really be aware of it. Like I know I had a pain condition and I didn't realize how, like the level of pain I was in until I had my first pain-free day. And then I was like,
Mm-hmm.
"Oh my gosh, I've been in pain for years and I didn't even like know it." Like
You
I
learn
just
to
thought,
live that way.
yeah, totally. You just like learn to like cope and just go through it.
Mm-hmm.
So that's another really good point that you make. Um, so burnout is really big on the podcast. I wanted to have you on because my number one episode so far was on burnout, which really shows like how prevalent it is, which honestly breaks my heart. That was my number one episode, but I really want to lean in it and make sure the people listening I guess, come away with some actionable tips. So, do you have any specific advice for those that are struggling and hurting at the bedside, whether it be like self-care, meditation, anything like that? And I know you said it's individualized, but do you have anything that you can share in that realm?
Of course. Yeah. So it is very individualized, and that's where I'll start with it. Honestly, like it's some introspection to figure out what your needs are in the moment because we've stopped listening to them. So number one is like know that you come first. Find a way to reaffirm that for yourself, whatever way that is. Find some support that you can talk to, whether that be coworkers, supervisors, friends, relationships, someone that listens, validates what you're saying that you can trust to get it out to, and then bring it up at work too, that it's a real issue. I mean, if you're shut down and you don't feel comfortable moving past there, that's one thing, but definitely make sure you're mentioning it to the people at work and see what resources are available. But the real key is meeting your needs because that's what we're not doing when we're burnt out. We're pushing those to the side. And sometimes it takes work to acknowledge what those are,
Yeah.
but journaling is a great place to start. Mindfulness is a great place to start. And I will always advocate breath work for nurses. Our nervous systems are so dysregulated from like alarm fatigue, from chronic stress. I mean, we are on high alert all the time. A lot of our nervous systems are just on edge. And breath work is a quick way to soothe your nervous system and get control in the moment. I do it every day before I walk into the ICU because I have to. But it's a great tool in the moment to gain some space to figure out where you want to go from there if you're experiencing burnout, because I think for some people they start feeling burnout and they don't know where to go from there, and there's so many options out there. Really figuring out what you want so you can move towards that is a pretty big piece. I know I
Yeah.
said a lot there. It is a lot though. It's such a there's so many moving pieces with burnout because it's the relationship you have with yourself, which is a complicated thing, and it's being neglected in the moment. So we have to repair that, and that's a complicated thing to get into. But as long as you start and keep moving, you'll make it. So
And I think that it's so complicated because my burnout might be different than your burnout. I might be sleep deprived and you might like not be eating and it might be a different thing. I really like that you mentioned bringing up to work your anything that you think needs to get advocated for. I am a huge fan of that all the time. I think that if your work doesn't know about something, then they can't help you. And I don't think your work wants to lose a good nurse.
Mhm.
The cost of replacing a nurse is like $67,000 a year. If they don't want to keep you for the empathy of their heart, they want to keep you for their dollar, like their
Mhm.
pocket. So they want to fix those issues, those really hard shifts that you've had. So if you can't find your manager like at that moment, find them the next day. If you're like upset, like I've left shifts like in tears and I know that
Mhm.
I'm too emotional. I can't process this right now. Like I can't talk to my manager. So like the next day or like a couple of days later when I'm in a better headspace. So but don't let it go because they have no idea that this issue is happening to you. And then the cycle just continues of another bad shift and you feel like you have no one to talk to you and you're just like venting it up. So
Yeah, I
yeah, go
I
ahead.
had a personal experience with just I had a great manager who I trusted, who I shared, and she honestly, the company I worked for didn't have a lot to offer me, which is was part of the part of the burnout. But she knew what I was going through, and I ended up calling in a lot. And it's actually the only time I've ever been in trouble. Like through my employer, but that is what saved me, is that she had known all along. I had communicated with her and she's like, I can help you. I will do everything for you because I realize like you're doing the best you can and you're being open with me with what's going on. So it's always an advantage for them to know, in my opinion, in my experience, for them to know what's going on, because then they have an opportunity to help. And then if they don't, that also tells you about the place you're working, that maybe you need to be looking for a place that does support you.
I love that you were able to get support in that way.
Mm-hmm.
I love that you said breath work too. I'm a huge fan of breath work. And even before I really knew what breath work was, I used to like pop my cheeks out when I would get stressed out, and that would just kind of like release the tension in my jaw. So even just like having like some sort of, if it's not breath work, if you're not like quite there yet, if you're not like really sure of what it is, if you can just like find some way to just like release tension in your body, just like
Mm-hmm.
shake it out, pop your cheeks, like whatever you have to do to just like bring aware, like bring awareness to the fact that you might be clenching every muscle in your
Mm-hmm.
body right now from stress, because that's what I used to do for sure.
Mm-hmm.
And that I so those like small changes, if you're overwhelmed by the list we just gave you, even finding those small, like really incremental moments, I found even like I used to bring like mint chapstick, and that would be like my mindful moment. So like I would
Mm-hmm.
put on like chapstick, take a couple of deep breaths, like really ground myself, center myself, and then like I would go about my day. So like these like breathwork moments and these mindful moments and like the meditation stuff that we're talking about, it doesn't have to be like a crazy routine for you to fit into your day. It can
Mm-hmm.
already be built in there by actions that you're doing, and then you're just kind of adding the breathwork in there.
Yeah, and breath work can be so simple. I do it with my stepson all the time. When like, let's take 3 deep breaths. I mean, it's the simplest thing. It's what I do before, when I get mad at work too, before I talk to somebody. So it's like, it doesn't have to be complicated. It can be. They have some amazing complicated stuff that makes you feel all kinds of ways that are fun, but it can be very simple. Just concentrating on your breath in the moment to regain a little bit of control. And I think it's a very helpful practice. So, and you know what, meditation is really hard for us some first, I think, to first get into, because quieting your mind, if you have a lot going on, that can be so hard for people to sit still. And what I love about breath work is that it's somewhat active. So you don't have to be like, I'm trying to be quiet. How do I quiet my mind? It's like you're doing something. So.
Yeah, no, that's a really good point, especially for nurses. I always found that it was really quiet or really hard to quiet my like really
Mm-hmm.
overactive mind.
Mm-hmm.
So yeah, breathwork's a really good option right there too. Um, so do you have any advice for nurses who are at the bedside and they just feel trapped? I spoke to one nurse just this week who asked to use her time off for mental health and she was denied. And she told me like a really hard story. She had a really hard day. She gave me all the details, which I love this podcast for that reason. I love that nurses are coming out of the woodwork. This was someone I had no relationship with, and she was like,
Oh,
hey, and I was like, yes, girl, I have you. I am so sorry, but like I'm with you and I feel you in this moment. Like you are not alone. Trust me.
no,
And
you're
there's been
not.
other people messaging me too. So do you have any advice for those people where they're trying to use their time off and they feel like they're bent up and they just need to get away? Like, what do you do?
That is so hard.
Yeah.
It's such a hard situation. First of all, I'm so sorry that that is the the answer that your manager gave you. You deserve better than that.
Yeah.
And secondly, like, you're not alone. I would say reach out for support. If you're not finding it through your employer, which sounds like you're not, find like a nursing support group, find a counselor, find a coach, find someone who can help you figure out a plan for what you need. Because if you want to stay in your job, then you're going to have to figure out a different plan to take care of yourself. And if your job is not working for you anymore, then you need to create an exit plan and figure out how you're going to move forward in that way. So I would say find support, know you're not alone, and accept help when offered, and practice self-care. And there's so many things I'll tell you. Like, I could go on and on and on, but honestly, like, be easy on yourself. I think we're very critical on ourselves. We shame ourselves a lot, and that holds us back. It is normal to burn out when you deal with the level of stress that nurses do, and that environment gets worse every day in my experience over the past 5 years. Like, you're not alone. It's an awful environment. It's normal to burn out in this environment, and there's more and more help out there available if you are willing to look for it and take the help out there. Like podcasts like this, coaches, a lot of free resources online. So just reach out and take it. And honestly, that the new opportunities I find open when I start reaching out for those new things. When I start helping myself, I meet people who you never know what will happen, what connections you'll make, what job you may find. So
Yeah, I couldn't agree. I couldn't agree with you more. I want to also, I guess, like jump off of that and say that I was really surprised. And also, I felt like really enlightened when I learned that the definition of burnout is an occupational mental health hazard.
yeah,
So, like, you are not doing this, you are not less of a person because you are, that this is happening to you. Your job literally caused this. Like, this is not you.
yep,
This is a hazard of your job. The same thing as if someone would, fall and maybe break an ankle at their job and it was an occupational hazard. It's a mental health occupational hazard. So if this is happening to you, you're not less of a nurse and you're not less of a person. And it also doesn't mean that you can't deal with stress. It's literally when like extreme amounts of stress happen to you over and over and over again, and you're not given the ability or the chance to really cope with it in an effective way. So that's the definition of burnout as well. And that was really freeing to me when I figured out what it was, because I mean, I've been burnt out too. And I was very much like, why can't I just like go do this? Like, why can't I just push past this? And so when I did another podcast on burnout and did more research into it, and I was like, oh, yeah, no, it's like not me. Like, it's not a fault of my own. It's my industry failing me and not
mm-hmm.
giving me the ability to succeed. So for all those listening and they just feel like they're having a hard time, like it's not you.
Yeah, and there's very little support in healthcare for this situation, even though they know it's a real thing. There are some companies moving that way, but it's very behind what's going on right now. And so,
Yeah. Yeah. I did
I
just
hope that's
have
validating, honestly, because it's
Yeah, yeah. I did just have a podcast guest on and she was I'm gonna butcher her what her title was because it's that innovative. She's from Jefferson Hospital. Her name's Kristen Gilmore and she's the program manager of nurse well-being and her only role is to support nurses in their well-being. I know. I geeked
like,
out.
that's amazing.
I know, I know. And she was there to talk to them through their hard shifts. She met every single nurse at retention at orientation. They all have a copy of their card and her phone number. She said that when she calls them to go over a bad shift, she always says like, I'm not here for blame. Like I'm not here to figure out what happened. Like this isn't a root cause analysis. I'm just here to check on you. Like how are you doing? How can I support you? How can we go from here? And that's Jefferson Hospital. And I was floored. I
I
thought that
love
was
that.
the coolest thing.
I love that. I have been a part of, so I've worked in a lot, I've traveled for years. So I've worked for a lot of hospital systems. And I have worked in some that support mental health. And I can tell you there is such a big difference in the culture there than at the ones that don't. I mean, like, I've worked places that don't need very little travelers because people love their job and they don't leave. Those places still exist where they support. They're just few and far between, I feel like.
Yeah, yeah. I think that it's really hard for like rural nurses too. when there's not a lot of hospitals or healthcare facilities around them, and it's like
Mm-hmm.
slim pickings when they get burnt out.
Mm-hmm.
I think that's tough. I also, circling back to what you said, I liked when you were giving some general advice to the woman that had messaged me saying that she was burnt out, and you put it back in their table. You said, if you stay, this is what you should think about, and if you leave, this is what you should think about. So I like that you are just like burn bridges and go. Like you're
Well,
like,
some people love bedside. It's their thing. Like
no.
I thought I loved it forever, and my priorities are shifting as I age, but I loved it for a long time, and like that's amazing. We need people that love it and stay and want to make it better. I mean, there's a part of me that has that too. That's why I can't leave. So,
Yeah. Yeah, no, I totally support that. Like I said, I love having the healing hand. I love making people feel better and
me
seeing
too.
it in real time. You know what I
Yes.
mean?
Yes.
I totally get
Making
it.
a real difference where you see it right there. Yes. Amazing.
Yeah. Yeah, there's nothing abstract about it. So yeah, I totally get that. But I love that you put that concept back onto them to really give the nurse like that sort of autonomy as well.
Mhm.
So that they can make that decision because I'm sure that's different for every nurse too.
It is. Yeah, that's kind of one of the beautiful things about coaching. It is so like it's so client centered. It's whatever they want. You're just trying to support them and figure out how to meet those goals and give them new perspectives and help them take on difficult things. That's why coaching is so amazing.
Mm-hmm. Mm-hmm. 62% of all new nurses deal with burnout. Do you think all nurses have to deal with burnout? Does healthcare and burnout go hand in hand, or is there a way that we can move past this so that healthcare workers and nurses can practice with their healing hands and support the industry without dealing with burnout? What do you think?
I don't think that all nurses burn out. I think there's those like rare unicorns who do a really good job of putting themselves first and taking care of themselves. And there just is not me or wasn't me for a long time. I think it is me now, but I think that's just not something inherent that a lot of people have. It's amazing for the people that do, but for the rest of us, the system is set up to burn you out, in my opinion. Like that's the path you're on without help. And I feel like the system knows that. I mean, that's kind of why I don't want to get like too off of this subject, but we're kind of numbers. And I think that is part of that. Like they know we're going to burn out. We're replaceable. So, because the system's set up that way, they've seen the research is out there. We know it happens. So I don't think it's a rite of passage. I think it can be avoided. I think that there are hospitals doing things to combat burnout and to support nurses, and it is in mental health support and in coaching programs and in unit programs that support each other. So there are places doing something about it, and it definitely could be taken on and treated differently. It's just getting that mindset to shift, and it's a very top heavy system that is difficult to make shifts in.
Yeah, no, I totally agree. I keep seeing the same like concept over and over again that there's not a nursing shortage. There's a shortage of nurses that want to deal with the same like terrible working conditions. And frankly, I agree because I'm one of those nurses.
Me too. Me too.
Good, yeah. And also, like, amen, because at the end of the day, we're like paving that road for the nurses that will come after us, and hopefully, like, it will be smoother sailing for them. And also, like, we're not even that old, so hopefully for us as well. Like, I'm a little bit happy to be shaking up the system and saying, like, no, I don't want that shift. Like, no, I don't need money that bad. Like, I'm good
Yeah.
where I am. I don't have to, while I do genuinely enjoy touching patients, seeing patients, exactly what we just said, I'm also okay with remotely helping people too to supplement that if it means I'm supporting my mental health away
Mm-hmm.
from the bedside. And I think we're seeing like a push of nurses that are like getting more keen to that. I think that like the remote nurse is like really rising where we didn't see this like 20 years ago. So it's a super like interesting like time to be a nurse because
Mm-hmm.
we have the nurses that have been at the bedside for a really long time. And if you had told like the 60-year-old nurse that there's like remote nursing, like a lot of the time I get a lot of pushback, like, that's not a nurse. Like, you don't have a nursing license. And I'm like, no, yes, I do. I'm a practicing nurse. Like, if you, and I've actually looked at the definition of nursing from the ANA to get like real technical, and I'm like, it doesn't say anywhere that I have to touch a patient or like administer a medication. I think it literally says to like benefit the health of a population. And like
Yeah.
as long as we're doing that, we can do it in different ways. So it's really inspiring to like talk to another nurse that's also like supporting that venture.
Yeah. Thank you. I appreciate that. I'm inspired by you as well. I'm trying to take on some of your writing tips. So
Oh, yeah, yeah, yeah. Let me know if you have any questions on that.
I will.
So I have some nurses that are interested in health coaching. I think that a lot of nurses don't know what health coaching was. I'm not gonna lie, I was one of those nurses that did not know what health coaching was. I thought it was mainly diet and exercise
Oh,
years ago. So I'm like really, really happy to be enlightened by this interaction. So what's your best advice for nurses listening out there that want to explore their options as a health coach now that we understand that it's such like a dynamic field and that it's not just like diet and exercise, that it can mean so many different things to so many different health coaches?
yeah, it's a really cool time to be a coach if that's something you're interested in because it's really blowing up everywhere. It's an even cooler time to be a nurse coach because there is a bunch of stuff going on in that world in the nursing community trying to advocate for that becoming its own thing and be in hospitals. Like there's a lot going on in that world too, which is really exciting. But you don't need to be a nurse coach to be, or you don't need to go through a nurse coaching program to be a nurse coach. You can be board certified and sit for those boards, but you don't need that to be a coach. I haven't sat for my boards yet. I'm planning on it, but I haven't yet because I've just been busy building my program. But you can, and you can take a normal coaching, get a normal coaching certificate, like a life coaching certificate, and combine that with your nursing knowledge and start coaching. Or you can go through one of the nurse coaching programs that are out there. I think a new one just opened this year that looks even cooler. They all build on each other. I mean, honestly, they just get better and better, and like including more and more of all these like holistic things we know. And they're trying to advocate for that, getting into hospitals. You can sit for boards, and then if that's something like having those letters behind your name is something that's really important to you, you can take that and advance that in a nursing way too. So it's really cool. And honestly, if you want to learn more about it, a lot of those programs offer free coaching for the people that are in them. So if you wanted to sign up, you could get coaching for free and then kind of learn a little bit about what the program's about. I think that's a great idea too.
Oh, that is actually pretty cool.
Yeah. Well, if you're curious, it's just a great way to see kind of what it's about. Because I didn't really
Yeah.
know what coaching was either. I was very skeptical because I'm like one of those people I'm proud of being a nurse. I worked hard to be a nurse and I don't want to just put that down. And, I'm like, no, 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 this is coming with me and we're integrating this. But for it, that means different things to different people. And the nice thing to know is there are a lot of options out there to use it. And I think the people that combine what they love in their off time and their nursing skills, like I said earlier, they're really the most successful people out there. So.
Yeah, yeah. You have a couple of interesting things that you said, like grappling onto your nurse identity. I will never say that I'm like a medical writer only online. I'm like, I'm a nurse, medical
Yeah.
writer.
Yeah.
Like the nurse will always be tagging along with me. I
Yeah.
worked so hard for that. The NCLEX was so hard. Like
Yeah.
I'm not dropping that RN anytime soon
Me
off of
either.
anything. Yeah, yeah. So I totally get that. And a lot of knowledge comes with the RN, you know what I mean?
It does.
Or LPN and NP, like we're a whole happy nursing family over here.
I think
Um,
that's something a lot of nurses don't realize, honestly, because we hang out with a lot of nurses. So we all have this basic knowledge. But when you step outside the nursing world, there is so much of that people never have any exposure to on so many levels. So you really have so much knowledge that people need and are willing to come to you for if you can somehow find a way to let them know you have it, you know?
oh yeah. I also love that you said that you're not certified because you can actually get certified for writing through the American Medical Writing Association, but it doesn't hold a ton of weight. And I'm not certified. That's why I haven't gotten certified because there's different markets. Certifications are really important, but I understand why people don't go straight away for every certification. Not all of them are like equal.
Yeah.
Um,
And
okay.
what's what you want to do with it too. It's not always necessary, to unless you're like if you're trying to get into the hospital system, you really want to make a difference. Those letters probably mean something. But if you have the specialty that's not kind of just maybe a little bit removed from nursing, or is outside of a hospital system, you may not need it. So it would just be a waste of your time anywhere, where you could spend that time learning more about what your specific thing that you're teaching people.
Which also fascinating because I don't think people knew that you could be a nurse coach in a hospital. Like I haven't seen that type of setup yet. So that's
Well,
also super
I think it's a
interesting.
very new thing. Like I said,
Yeah.
there's things changing in that world that I'm not like involved in the change. I'm just keeping my like, keeping my eye on it. But yeah,
Yeah.
I know there's a couple nurses that have introduced it to hospitals, and there actually was a coaching program. I think the Mayo Clinic did it for physicians that had existed, that I think that like it was going on during COVID, and they actually retained, I think, the largest percentage. I can't remember the numbers. I'm not a good number person. I should have wrote it down. But the largest percentage of their physicians during COVID, and the physicians themselves attributed it to the coaching program they had. They were coaching the physicians as they went through it. So it was really interesting. It's not nurses, but it's the concept of coaching in the hospitals that was the support. So I'm like, that's amazing.
Oh,
Let's do that for nurses.
yeah, it's so wild. Like, I don't know. It just seems like such a no-brainer to me. Like,
Yes.
I don't know. Hopefully the rest of
There's
the
a lot of
industry.
things like that in healthcare sometimes, right?
I
So,
know, that's so true. Well, hopefully the rest of the industry really catches up to this because it seems like a really, like I said, like a no-brainer here that we can like really support our nurses with this type of coaching that you have. Jen, do you have any like thing that you want to end with? Any closing words, anything like that?
I would just say it's always okay to say no if it's too much. Like, do not be pressured into picking up extra shifts or saving your unit or doing anything administrative like that at the cost of yourself, because it will never reciprocate itself in the way you want it to. Honestly, you're worth so much more. It's also always it's okay to say no to taking extra patients if you're not comfortable. Like, do not, I feel like that it's something that's hard to develop as a nurse, and they really like don't tell new nurses like it's okay to say no, I'm uncomfortable with that. And honestly, when I've ever taken that to a supervisor, I've been supported when I use those words. So
Yeah, yeah. I remind people that all the time that it's not your job to fill empty shifts. It's not your job to fix the staffing ratio. It's your manager's job. You're a
yep.
shift worker working at the bedside, and if you're doing that, you're actually taking the workload off your manager. So, like, whoever is your administrator really needs to be solving those issues, not you. And
Yep.
if you're saying no to a shift, if you're taking time off, you're not letting your coworkers down. Again, your manager is letting your coworkers down because they don't have an effective float pool. So please, please, please take the time off you need. Say no when you need to say no. Protect your flame because your hospital is not doing it for you. Jen Ohlinger, thank you so much. This was such a great conversation. You can find her at the moonflowercoachingcollective.com. You can find all of her resources there, including her super amazing 7-step program for stress relief. She also has a free burnout assessment if you guys are interested. Jen, thank you so much.
I appreciate it. It was so much fun. Thank you.